Thank you. Hello. Okay. Before I begin, I'm very fortunate. I think this is the 5th time I've been to Italy. I think 5 times. And I'm very lucky to see so many faces I know. It takes me a while to remember the name, but I know the faces. So thank you. Before I begin, I need to acknowledge my colleague Joseph Cherokee. Joe is a good friend and mentor, and we have been working together. I think we're getting close to 10 years. So he and I do this work together. And we fight a lot, and we do the work together. I also need to acknowledge the people in Italy who have done lots of translation work. I didn't want to list names because I thought I'd leave someone out, so I just put the Italian mob. So thank you. Mob is an Australian word that means a group of kangaroos or a group of people, either. So it's a good term. And also my gorgeous family, my 2 sons and my husband and their partners, or as my family call it, Family 2.0. That's what they call themselves, Family 2.0. So today I'm going to talk to you about, let me help you understand the slides. If it has a blue background, it's a general all of psychology slide, colour-coded. If it has a white background, it's about the work Joe and I were doing. So blue or white. So I'm just going to give you an overview of the talk today, and it rests largely on the work being done by my mentors and colleagues, Steve Hayes, Stefan Hoffman. I'm going to talk with you about, from an all of human psychology perspective, their work on process-based therapies, and then explain how Joe and I have done this in our work with young people. We started doing this 4 years ago, and it's finally coming together. So talk with you first about where we have been. In psychology, much of psychology for the last 30 or 40 years has been based on syndromes. And that's been really complex for us to navigate our way around syndromes that were built on a medical model. Much like a medical model, syndromes assumed that if we could identify a syndrome, then we would find a therapy to fix it. And we ended up with something like this. A DSM with many, many syndromes. And just a Wikipedia list, 164 different versions of psychotherapy. Oh man, that's really hard. So what we do know from the research is that the syndrome to treatment, syndrome and diagnosis does not predict treatment outcomes. So we know that we lost our way trying to navigate this complex landscape using a medical model. So we turned to evidence-based therapies, thinking that evidence would be our answer, and it partly is. But now we have this problem. This is just an example of the various CBTs. And ACT, of course, is one of those cognitive behaviour therapies. But we ended up with so many. There are at least 33 different kinds of cognitive behaviour therapy. So we still ended up making it hard. And the challenge we have set for people who are practitioners is to use the evidence base to inform their decisions. That requires them to follow these 5 steps. ask the key questions. What does an individual need? Acquire the best evidence for that. I can't see my slides from here, it's tricky. Officially appraise the evidence, number 3, and then apply that evidence in a collaborative way and disseminate. I just want you to notice point 3. Point 3, critically appraise the evidence. I would like to think that I can do that, but I know I can't, and I don't, because this is what it means. Every single year, just looking at the terms psychology in English and peer review, you get 220,000 articles every year. And even if we drill that down just to meta-analytic studies, the ones that are meant to help us, there are 352 a year. So if you were to stay on top of the evidence just in English, you'd need to read 1 meta-analysis a day and understand it. It's impossible. And then, of course, English is not the only evidence. We still focus far too much on English when there are great studies being done in lots of different non-English speaking countries, Italian being one of them. So we tried manualised treatments, putting treatment packages into manuals. And in my country, in Australia, most psychologists are taught with a manualised approach. So they don't learn the theory very much, very little. They don't learn what's underneath the hood. They just learn the manual. The clients don't fit with the manual. So when our clients come in, we don't know what to do. So a process-based approach is different to a manualised treatment approach. And so we made an attempt to unify all these manuals and all these treatments with transdiagnostic approaches. ACT was the forerunner of the transdiagnostic approaches, begun, I think it was around 30 years ago. ACT began, I think, were the first of the CBTs to say, this is not okay, we need to go back to our roots, we need to become transdiagnostic, people don't fit in boxes. And now we have ACT as a transdiagnostic therapy and unified protocols of CBT and other more unified protocols that are considered to be transdiagnostic. And if you look at the evidence just for ACT, we've just reached the 250 randomised controlled trial mark, which is not bad for an amazing group of community members, but it's still always or mostly looking at packages and treatment manuals. We had to play that game. And in my area, the evidence for young people is dismal. In all of that time, this is the list of randomised controlled trials for children and adolescents in English. And if they're our future, we have to find a different way, because we will never ever have enough evidence and enough money to evaluate a whole package treatment using a gold standard randomised controlled trial. And I need to acknowledge, again, I don't have all of the citations, but I know there is a lot of work being done in Italy for children and adolescents. I said to Nani yesterday, I think there is more work being done for children and adolescents in Italy than anywhere else. I know you're a very active community. But still, it's a hard ask to get these big randomised controlled trials with a whole treatment package for children and adolescents who don't always come for a whole series of treatments. The modal treatment set number of sessions for a teenager is 1. So we'll never get through a whole 8-session protocol. And as a discipline of human psychology, we still ended up here fighting over who had the best package. And so this book that I'm referencing, the CBT Processed Approach, is a new book that just came out this year by Steve Hayes and Stephen Hoffman. And it's sending us back to the roots of psychology. And I'm going to walk you through how we have done this over the last 4 years to come up with a process-based approach to looking at work with young people, work with children and adolescents, so that you can see the journey that we've been on. And when I say we, I mean my colleague Joseph Cherokee and I. So the assumption, the approach argued for in the CBT-based approach book is that we need to look at 4 things: assumptions, theory, processes and procedure. And that if we look at all those 3 forms of evidence, we can return to where human psychology started and step out of the labelling, treatment manuals, diagnostic syndromes approach. So we know what matters to treatment outcome is not diagnosis. What matters to treatment outcome? I need to look at the slide. What matters to treatment outcome is the therapeutic relationship. The processes that we know are established in the literature. Simple processes that have been well established, like exposure. And then we know understanding mediation. Which processes really create the change with a client? Not a whole package, but which of the behavioural processes move the outcomes. And then we need to look at moderators, what works for whom. So now an example of how we've done that with young people. Joseph and I looked at assumptions, theory, process and procedures and the whole package. And it took us about 4 years with lots of work behind this to come up with this approach. I'm not at all advocating that it's the only approach for children and adolescents. My purpose to talk to you today was hoping that you would see the way something like a process-based approach can inform your work no matter who you work with or what research you're doing. So the work and that we came up with we called DNAV. And you'll hear the Italian words for that when we get to those parts. So it's a process-based approach for working with young people. So we begin by stating our pre-analytic assumption. And this is the same for all of ACT. We have the same assumption. Assumptions have no right or wrong answer. It's a bit like arguing, is a Samsung better than iPhone? You'll never win that argument. So it's better just to state that you like iPhone and your friend likes Samsung. So that's the place we come from. Our pre-analytic assumption is one of functional contextualism. Most child and adolescent work comes from organicism. Organicism is that developmental path, that there are clear stages that a young person must go through. So most developmental work is done in that area. And for those of you who have been trained in cognitive therapy, you'll know that follows an information-based approach. So we make the assumption that function and context matter. When the philosophical assumptions behind function and context mean that all behaviour occurs in a context, then we can never look at one without the other. And when you start to understand context, it's an amazing experience. I think it was the most mind-blowing experience for me to really understand what a functional contextualist means by context. And it means things like, if you can remember a teacher that you had in primary school and they can influence your behaviour today, then you really understand the power of context, especially for a young person. And so we look at all of that together. So our assumption is that everything that happens for a young person occurs in a context, and we can never look at one without the other. We make the assumption that behaviour is everything a human does. Thoughts, feelings, actions are all behaviour, and context is everything that surrounds them, including all of their life history, but their parents' life history as well, and even the environment of adaptation and evolutionary science. So we consider all of these to be context. Our theoretical foundations, there are quite a few that we use in DNAV. The broadest one is evolutionary science, and we built our model and our approach to young people on evolutionary science. I need to switch sides so I can see my slides. Okay, that's better. Oh, how did I make that happen? Oh, you did. Okay, so we begin with the broadest theory applicable to development, and that is that our environment of adaptation as humans means that we have some needs that come with a child, such as attachment, the need to be nurtured by a group, and that our principles of learning will fit within an evolutionary science model. I can't explain, because it's too detailed and complex, this diagram that you're looking at, but it's inside this new book, Evolution and Contextual Behavioural Science. And we were lucky enough to be able to look at development from an evolutionary perspective. And then you start to see things like the life history of a young person will influence the kind of work that you need to do in ACT. Someone who has grown up in a harsh, unsupported environment, the questions you ask about values need to be completely different, because from an evolutionary perspective, a harsh, unsupported, unsafe environment means that you will grow up quick, and that this will completely change the behaviours that we look at for a young person. We can't ask somebody in a harsh, unsupported environment what they value in terms of standing for something important for a long term in the future, like graduating college. Instead, we need to ask and talk to them about what they care about right now, because life is harsh. And we know from the research that a harsh, unsupported environment means things like early puberty, early sexual activity, much higher risk-taking. All of those things are built inside the work that we do, and we look at every process inside that assumption. We look at behavioural, then our next level down is to look at behavioural principles, Skinner's operant principles, and of course relational frame theory. I'm not going to explain relational frame theory. You'll find it in this conference somewhere. And then we looked at positive psychology and the work that we need to do to think about growth and development. So it's not just static, it's how do we help a young person grow. And so we used the growth mindset work of Dweck, we used broaden and build theories of Barbara Fredrickson, and we used self-determination theory of Decky. We need to think about how do we create growth and autonomy. This is the CBT process book for adults. And I'm going to skip that because we've already done that. If you look at just in this one book, there are more processes, but this one book covers these as the core processes that underpin CBT evidence. Many of you would be familiar with these processes. And then the procedures are what we use to get at that process. So a procedure is a technique or a method that a therapist uses to achieve a treatment goal or a treatment outcome. So we want to look at procedures linked to processes, linked to theory, linked to assumptions. And a procedure might be, let's say, a values in adult work. A procedure might be a sweet spot exercise or a card sort, something that's getting at the process of value. So that's the way processes end up being used in therapy. There's a process and then a procedure. So for DNAV, we have 4 processes that can be thought of as classes of behaviour. And there's not a one-to-one translation between the adult ACT model and this developmental ACT model. Many people read this and they hear adult ACT with different names, but that's not the case. Mediation studies are also in their infancy with young people, and it's really hard to find the work. If you're a student, measuring mediation and change is a really important thing to do. So now I'm going to talk to you about the processes and link them to procedures. The first process is value. That is similar to the adult process, very similar. But the process as we define it is creating a context that empowers young people to clarify what they care about or what brings them vitality. It's not just value as an adult value, but also vitality. How do you create energy and fun and engagement? So the core process from a CBT perspective is values, and the procedures we use include the 6 ways to wellbeing, language clarification and choice. Why we do that? This is Joe's work, and we connect 6 ways of wellbeing in value, and you can see here that they correlate on the general health questionnaire with wellbeing and on measures of flourishing. This study is just in press. So when we work with a young person, we work across those 6 ways. If you look at mediation studies on value, this is just a list of citations. Some of the mediation studies on value are really important for young people, and the last one I want to draw your attention to. In the last one, if you connect a young person to what they care about and just ask them to write down some things that they care about, it reduces the racial achievement gap. That's pretty good outcomes that we want. So we need to think carefully about making sure that when we work with a young person, we always connect to value and really understand that we can shift processes if we do these things. Just writing down what you care about reduces the racial achievement gap. That's pretty important information for us. So when we link values as a process to procedures in DNAV, our job is to create settings where value and vitality are in everything we do. So when I train clinicians, I ask them to make sure vitality is in every single interaction. Not just left for session 6, but every single interaction includes vitality, and that we tap into values in what we call values light, all of the time, every single session. So the values is similar to adult work, except it includes vitality, and it's about engagement and the current moment sense of this is something meaningful. The second process is what we call a noticer. And there is an Italian translation, I'm sure just came through to you. A noticer. This little fella is a noticer. Everybody came into the world able to do this. So when we work with young people, we make it clear everybody can do this. We all start this way. And it's the process of helping people to notice what's going on inside them, what they feel, what the sensations are in their bodies, also what's going on outside them, what they notice in other people and the world around them, and then helping them to choose their responses. So the core CBT processes include shaping and exposure and mindfulness, emotion regulation and acceptance. So it's not just a translation that the noticer is being present, as it is in the ACT model, but it's actually all of these processes put together. And we include in here non-CBT processes, particularly the work on attachment and safety, and look at how evolutionary science and theorists like Porges' polyvagal theory can help us understand the growth and development of a young person and help us build safety with them and help them practice how to be safe in the world. In terms of mediation studies, there are a number of studies. We have to lean on some adult studies. But the studies show that if you can help a young person identify their emotions, it changes their outcomes and helps them function in the world. Identifying your emotions, choosing your response is a really important part of this growth. And the procedures that we use is to normalise and bring into awareness the process of feeling and experiencing and feeling when other people feel too. We help people attend and label it, something that's really important in development and something that we don't see very much in some specific areas, like kids with trauma, young people who have autism or are on the spectrum. We see that these are particularly hard skills to develop. Young people who have grown up with lots of anger, being able to attend and label. We also teach people how to allow or react, and those are the two anchors that we teach people, allowing or reacting, and inside here we practice self-compassion and mindfulness and attachment and safety-seeking procedures. The next process we call the advisor. Loosely, sometimes we talk to young people about it being self-talk, but it's actually the process of helping people to navigate their context with language. And remember, their context is all of their history and all into the future. It's the process of talking to yourself. It's the process of saving yourself from trial and error. So we use CBT processes like cognitive diffusion and cognitive reappraisal and problem solving. But we also use RFT to think about how to shape flexible language, how to shape flexible rules, the developmental stage of the young person, how to help them identify coherent seeking or being sticky with rules. And the mediation studies, again, mostly adult, occasional adolescent studies, showing that diffusion can be very helpful in terms of changing outcomes, depression and mental health. And the procedures that we use to build a flexible advisor, a big one is normalising the process of thinking. Young people have just learned how to think and they get stuck on it. We also look at practicing changing rules and being flexible with rules. We look at testing out the helpfulness of rules. We practice diffusion, and we also create flexible rules and test them, and we use problem solving. All of them are inside the advisor. And we think loosely the advisor is a metaphor for the cognitive ability we have to save ourselves from trial and error. So we can predict what's going to happen in the world based on our history. The flip side of predicting is the process that is uniquely developmental, that we call the discoverer. The discoverer, I always remember the discoverer as when a baby gets to a certain age and they can drop something off the side of their table or high chair onto the floor and find out what happens. And they can do that over and over. So if you think about the power inside that, you have a baby who is born noticing the world, and then eventually they find out that they can push things and poke things and make things happen. You can imagine how powerful it must be to be able to drop something and watch your mum or dad pick it up and then drop it again. It's enormously powerful, and it's part of our evolutionary heritage. It's the process of trial and error in order to learn. Loosely, we talk about this as the process of helping young people explore in order to develop skills and resources and expand their context. We use CBT processes. Many are familiar to you: functional assessment, contingency shaping. But we also use non-CBT processes: risk-taking and adaptation, growth and self-determination. What we want to do inside the Discoverer is think about, how do I help this person expand their context, expand their life? Mediation studies show a number of different behavioural pieces. The last one, self-determination-based intervention that enhanced autonomous motivation, reduced screen time. So we start to look at how our outcomes can be influenced in the studies. I need to go quickly on the slides. Procedures, functional assessment, I mentioned, behavioural strengths, setting goals, linking tasks like risk-taking, love of novelty and sensation-seeking, which appear in adolescence, in humans and animals. In children we link play. Play is not a value, play is an evolutionary adaptation that we have that helps us learn how to manipulate the world. So that's the 4 key processes, and then we look at 2 perspectives. The 2 perspectives on those processes are the world of the self and the world of the social world. And they influence how we use our behaviours. So the self is not a new thing, but understanding that the way we learn to use our discoverer, our noticer, our advisor, and value influences who we think we are. And then who we think we are influences how we use them. Some recent work just coming into press, or just published actually. Oh no, it's 2 years ago. Some recent work published by Joe Cherokee. He's been doing a longitudinal study for many years. And this one is looking at teenagers across 4 years. And we're starting to see that things that we have not paid much attention to in ACT, like self-esteem, actually consistently predict self-compassion. So we need to start thinking about these areas of the self. Self-esteem might be what we call your advisor self, your rules around who you are. Self-compassion is what we would put inside the noticer space, and thinking about how you can be aware of your emotions and what goes on inside you. And then the social view, again, is not a new process, but looking at the decades of research that we have on attachment, on development, showing that we are a species that need others, and from the minute we're born we connect to other people, and that connection never leaves us. So when we work with a young person, we always include their social world, their history of attachments, and the history of friendships along the way. We're never alone. As a psychologist, most of my training was looking at people and what goes on inside their skin. When we came to do DNAV work, I realised how wrong we were. We needed always to look at a young person and everyone around them, because that's where change happens. So I want to return to this. Our work is always about creating contexts where what matters to me and what matters to you are central. That's what DNAV is all about. And we consider it to be a developmental model of how to use ACT. But it's also a way of seeing how to build a process-based approach from assumptions to theory to processes and to procedures. And also, one of the things that we discovered along the way when we went on this journey was that we get stuck inside even our own concepts, like the act hexaflex. We got stuck in that, and it trapped us for a while. We couldn't really understand all of development just by looking at the hexaflex. And I know when people look at DNAV, they always say, what's the one-to-one translation? Is the advisor diffusion? And we say, only partly. So it takes a while to get your head around new words and new concepts. And so the other part that we always rest in when we work with young people is that nothing grows people like love. And I'll leave you with a little story. This is my youngest boy who has anxiety, and he's extending his behavioural repertoire by being in love with someone who's forcing him to watch musicals. Mamma Mia. And he's an engineer at heart, so musicals are not his thing. So in the end, what we think about is, how do I help a young person expand their context and do that with social connections as well as inside the individual? And there's some citations here. I presume the slides will go out to you, but if you want to follow up and look at some more, the easiest place is to go to the second website, which has a typo, thrivingadolescent.com. And on thrivingadolescent.com, Joe and I have made it our mission to give away as much as we can. So you'll see animations explaining it to young people, scientific publications, and many free resources as much as we can. And I was just talking to some people about translating the animations into Italian. If somebody wants to do an Italian voiceover, they're yours. So that's the end of my talk. I think, have we got time for questions? Do we want questions, whoever is in charge? I know you've been in workshops all day. Do you have questions? Nani, do you want to say something?
No, just take the question. Avete domande da fare? Potete chiederle in italiano e mi offro ben volentieri di tradurle. Un passaggio chiave, I'll ask you a question then. Okay. Un passaggio chiave che mi è sembrato importante cogliere, e vorrei che lei lo sottolineasse di nuovo, è il fatto che l'ACT è nato in una clinica per adulti, mentre qui stiamo parlando di bambini, prima ha parlato anche di bambini, dandoci credito di molto lavoro sui bambini, ma soprattutto di adolescenti che crescono, e quindi il lavoro da guardare è un lavoro di tipo dinamico, completamente diverso da un lavoro di tipo con il lavoro che si fa con l'adulto. Come dice il prof moderato, non è una forma miniaturizzata di ACT, è qualcosa di diverso. Volevo chiedere se poteva espandere questo concetto, perché mi sembra importante, soprattutto in relazione a quello che poi stiamo andando ad evolvere nella CBT basata sui processi. I'm curious because you underlined the fact that working with adolescents is completely different. It's not a reduced version, a miniature version of what we do with ACT. So can you please strengthen a little bit more this concept, and also how we relate this with process-based CBT?
Okay. And I can. So Nani, one of the key things the easiest way to point to it is to look at this behaviour that we call the discoverer. So across adolescence, if you look at human adolescence and animal adolescence, the key characteristics are risk-taking, love of novelty and sensation-seeking, and changes in family and peer relationships. And that happens in animals and in humans. So if you have a process in animals and in humans, you know you have some adaptation, some evolutionary adaptation. I don't see risk-taking as a process that we typically do in ACT, although I guess you could say committed action, you might take risks, but it's not the same risk-taking. So risk-taking we see as developmentally appropriate, and our job is to help young people take adaptive risks, not maladaptive risks. The other part that I think, so that's like one piece that you can see that I think is different. Of course you could twist adult ACT and say, well, committed action is risk-taking, but it's not the same, because adolescents have to take risks and they don't know what the outcome will be. They don't even know if they care about it. They have to take the risks and find out. The other part I think that you see inside the Discoverer that's really different is play. I think many people talk about play as a value, but from an evolutionary perspective, play is about survival of the species. And play often looks like learning to manipulate the physical world and learning to be a social species. So children will play mums and dads, and they'll also learn to climb and do those things. So there's an evolutionary survival aspect built inside that. So I think that's one clear way of seeing that it's different to what we might think about with adults. Thanks for the question. You're trying to make sure I got a question. Thank you. You can ask in Italian if you want, or English, any.
Ok, thank you. Volevo chiedere a quale esigenza corrisponde?
Forse
non so se sentono le...
A quale esigenza operativa corrisponde il ritorno, diciamo, ai presupposti filosofici, philosophical assumption? Perché questo ritorno ai presupposti filosofici?
Okay, that's a great question. From a practical point of view, that's a fabulous question, Roberto. Let me back up and show you the... Okay. So in the CBS community, we tend to use Pepper's work, arguing that there are 4 basic assumptions, or 4 ways of seeing the world. From a practical perspective, let's take the bottom 2, contextualism and mechanism. From a mechanistic perspective is often how cognitive therapy was understood. So from a cognitive therapy perspective, when something is wrong, we look for the broken part, like an information processing, like a computer. Something goes in and information comes out. And often that information is decontextualised. It's, from our perspective, it's not necessarily seen as a whole. For example, we look for, let's say, black and white thinking. And we might try to change a person's black and white thinking. Or we might try to change their core beliefs, assuming that that's the part we need to target. The organicism as a contrast, organicism is often what's looked at when you look at developmental psychology. It's an assumption that humans go through stages. And so we need to look at that human, a child for example, and say, have they reached the milestone at the right time? And if they haven't, that's the problem. From a contextual point of view, what we care about is always behaviour in context, knowing that there is nothing, you can't have one without the other. And so behaviour might be perfectly appropriate in that context. Let's say the behaviour of acting out, externalising or anger behaviour in a young person. That might be a very good behaviour in their context. That might be perfectly adaptive to keep them safe, to push other people away, to maintain dominance and power. So we would never look at that as a dysfunctional behaviour. We would look at the context and say, in what context has that occurred and how is it working for that young person? So it's very different. And if you want to contrast, Roberto, formism is the picture here I have is the big five, assuming that there are categories of things, like the big five personality factors. There are categories, and we can put categories in boxes. That's what the DSM is. There are categories for things, and things have names. Correct names.
Paolo. Altre domande? Curiosità?
Marta. I forgot to mention, Marta ran a DNAV workshop today with her colleague, whose name I have forgotten. So Marta knows all about DNAV. You can just ask her.
Non ringrazio lui per la spiegazione.
You can ask in Italian, Marta, it's still okay. But everybody else knows the question.
La domanda è rispetto alla slide che hai fatto vedere sull'autostima.
The question is about the slide self-esteem.
Perché mi ha colpito il ragionamento diverso da quello che appunto ho sentito altre volte fare, c'è nel libro, rispetto alla contrapposizione fra autostima e self-compassion. Mi interessava, andrò a vedere molto volentieri la ricerca, ma mi interessava soprattutto sapere, visto che l'autostima è un costrutto con delle definizioni molto varie fra di loro, e quindi credo che dipenda molto dalla definizione che si usa, qual è, secondo, nella tua visione, il tipo di autostima che contribuisce alla self-compassion e al buon funzionamento dell'adolescente?
That's a good question. I wish I was Joe. Joseph Cherokee started talking to me about this study, and when he began to find longitudinally that there was something different in self-esteem and self-compassion compared to what we often talk about in the ACT world. We often talk about self-compassion as more important and self-esteem as in some ways destructive. But his research across a number of studies has shown something different. So this one is that over 4 years, having high self-esteem predicted self-compassion over time in young people. But it didn't work the other way around. So you can see in this slide, having self-compassion didn't produce self-esteem changes. So it's something that we have looked at in DNAV. And one of the things we think is self-esteem can be a form of a flexible advisor rule. Not in a narcissistic way like I am amazing, but I can do this. Or I can get some things done. So as part of doing our advisor work, we look at flexible rules around the self. And I think that's where we need to go with self-esteem. Flexible rules around the self, and we do that inside your advisor. We need more research. You can do some, Marta. Thank you. It's a good question.
Altre domande?
I think we're starting. Are we starting Anthony at 5?
At 5, yeah.
At 6? Okay.
5 minutes. Okay.
Okay, thank you very much.
Thank you very much.
Thank you. Thank you.
Sentono tutti. Hi Tony. Just 1 second, we are going to introduce you, okay?
Sì, però noi non sentiamo lui, io non sento più lui adesso, non vorremmo rispondere. Come faccio a sentirlo?
Just 1 second, we're arriving, okay? because I don't hear you. Hold on.
Sentiamo basso, basso il
No, nel senso che si deve sentire...
Sì.
Ah, bene.
Lui ci vede o non ci vede?
Sì, adesso vedo...
Guarda, no, se ti sposti un filo più in qua... Ok, adesso ti sta vedendo.
C'è, no. Guardi là.
Yes.
Oh, good.
Hi, Tony.
Hi.
Oh, good to see you. Good to hear you. Can you see me? Can you hear me?
I can see you and I can hear you.
Okay, thank you very much. Let me introduce you.
No, aspetta un attimo, si può mettere il condividi di schermo? Sì, noi dobbiamo mettere
Just a minute.
Ah, ok, però volevo fare la prova delle slide prima che lei inizi così, poi
Okay.
urlo iniziare.
Let's make a rehearsal of projecting slides.
Lui dovrebbe fare share screen.
Can you share the screen?
You want slides?
Yes, please.
Okay. Can you see that?
No.
Okay, we got to do share screen.
Yes.
Bottom
let's see.
right. Bottom right.
Bottom right.
The two squares. The two squares on the bottom right.
Got it? Okay. We're going to do this, I believe. Share screen. Here, I go here. Now how are we doing?
Okay,
Got it?
we got it.
No,
Okay.
facciamo noi, l'abbiamo... Allora, se tu...
There's still a question of seeing me, I think.
Yes, exactly. Now we see both. The slides and we see you.
You do.
Yeah, we do.
Hey,
Ah,
you like my tie?
Okay, perfect.
però adesso abbiamo finito.
Dimmi quando lo
Adesso.
Okay, you are on the big screen. So, okay, I see you here. Welcome, Tony, to this conference. I'm very honored to have you here in this long distance conference. But you know, traveling now became a nightmare. So we try to use as more we can this kind of connection between moving our bodies. We just move our minds. È veramente un piacere avere qui oggi Tony Biglan, professor Biglan, perché considero che sia una delle persone che in questo momento nella scienza contestuale del comportamento abbiano delle visioni più ampie e più profonde. Non è solo un clinico, ma è uno scienziato che ha la possibilità di spaziare lungo diversi campi del sapere che sono estremamente importanti per l'umanità. Io ho avuto modo di incontrarlo più volte nel corso di varie conferenze in giro per il mondo e devo dire che mi sono sentito molto arricchito delle prospettive che ci ha dato. Ha delle prospettive verso il futuro, ma nel contempo ha delle forti radici nel passato, perché ha dato un contributo molto importante alle rivalutazioni nel suo libro The Nurturing Effect, una serie di rivalutazioni di quelli che sono dei fattori fondamentali per crescere delle generazioni nutrite bene, non tossiche. Io spero di riuscire a tradurre anche il suo libro in italiano, perché è un libro veramente molto, molto importante. So thank you. I just described, Tony, your contribution, your wide contribution in the field of having a wide vision for the future, and at the same time deep roots in the past of what the science of the contextual science of behavior can offer to human being. So thank you again for being here, and hope to see you physically soon. Thank you, Tony. The floor is yours.
Well, thank you very much. I appreciate your patience and your willingness to have me speak to you from my home in Eugene. In addition to it being easier to speak to you when I roll out of bed an hour ago and do this, I'm trying to reduce my carbon emissions, and so I've been trying to reduce my travel. And I don't know how well this will work for you, and I'd be very appreciative of any feedback. But I think if we can get better at this kind of telecommuting, we can reduce our carbon footprint and have a small impact on preventing climate change. So that said, let me launch into what I have to say. I think that I first want to say that the most important science that we have in terms of the well-being of the world is behavioral science. And most of what I'm doing lately is trying to get the world to understand, both behavioral scientists and the rest of people, that what we've learned about human behavior in the last 50 years is what can save us from the problems that we face. The things that the physical sciences and biological sciences have brought us are a mixed blessing. We have airplanes and bombers and piston engines and climate change and nuclear power and nuclear weapons and the internet and terrorism. And don't get me wrong, I mean, many of the scientific developments from the physical and biological sciences have massively improved human well-being. But as B.F. Skinner pointed out 70 years ago, without behavioral science, we don't have the way of influencing human beings to make the best use of what we have and to prevent the worst things that can happen. So the first thing I want to talk about is the social determinants of health. The reason I want to talk about that is that this is the fundamental reason. It's the best example I have of why what you do is so important to the well-being of society. Now, some of this comes from the United States, and I admit that the United States, and by the way, I realize that the ridiculousness of an American telling you how to run a country. I know the problems that our country has, and I'm sure you're aware of them too. But I think some of them are also being experienced in Europe. So let me talk about the social determinants of health, because this is a good example of the way in which what you do is so fundamental to human well-being. This is a chart that shows the factors that contribute to premature death. Now, this is data from the United States, and it may be different in Italy. You probably have somewhat lower levels of these things. I looked at the statistics on the well-being in Italy, and you're way out ahead of us in many ways. But in general, the evidence is that behavioral patterns account for 40% of premature deaths. Things like cigarette smoking and antisocial behavior and academic failure and depression are all, and in physical inactivity and obesity are all factors that contribute to premature death. Then look over here, and there are the social circumstances. 15% of premature deaths are due to social circumstances, and those are primarily loneliness and social conflict. Social conflict is a huge stressor for people. But let me point out something else. The social circumstances are also the things that contribute to the behavioral patterns. Kids who grow up in families that are high in social conflict are significantly more likely to develop all of the behavioral patterns that shorten life. So I submit that, at least in this country, as much as 55% of premature deaths are due to things that that the work that you do can have a significant impact on. So, how many are familiar with the research on adverse childhood experiences? Could you raise your hand? I can't see you. Okay. There's a physician in Southern California named Vincent Folletti. And Folletti began to study the degree to which his patients had had any one of these adverse experiences: physical abuse, verbal abuse, sexual abuse, physical neglect, abuse of one's mother, a family member in jail, all of these adverse experiences. And what he found was that his patients who had 4 or more of these were significantly more likely to have all of these problems. Alcoholism, chronic obstructive pulmonary disease, poor work performance, adolescent pregnancy. All of these things become more likely when people are exposed to adverse experiences. And I think this is one of the things that's been motivating a lot of attention to the way in which we can reduce these adverse experiences. And there's a lot of attention, at least in this country, to trying to be trauma-informed in terms of recognizing that the people you're treating for, let's say, cardiovascular disease may have a history of trauma that's relevant to their situation. What it means to me, however, is that we need to put more effort into preventing the occurrence of these adverse experiences. There's a wonderful book by Robert Sapolsky called Why Zebras Don't Get Ulcers. And it's a compendium, it's about this thick, and it's a compendium of all of the things that, all of the stressors that cause problems for human beings. And there are all kinds of things that are a direct result of stress. The way stress works is that a stressor, let's say the zebra sees a lion, causes a cascade of hormones that result in the release of cortisol. And cortisol increases the heart rate, increases blood pressure, and it enables the organism to either take flight or to fight. Now, if you're a zebra and it's a lion you see, probably best to take flight because you're not going to beat up a lion. So if the zebra is fortunate enough to have an older, slower zebra nearby, the zebra gets away and it's over. So what happens? Well, the stress hormones get reabsorbed, the heart rate goes down, the blood pressure goes down, and it's not a problem. So why do you suppose it is that humans have so many more stress problems than zebras? And if you're an ACT therapist, you probably have an idea of this. Well, let's do an experiment. Would you raise your hand if you've ever found yourself lying in bed stressing about somebody who was not lying next to you? It's the human condition. Humans are able to be in the presence of stress simply by thinking about it. We think about what happened a week ago. We think about what's going to happen tomorrow, and we can experience stress. And if you're an acceptance and commitment therapy, you're familiar with that, you recognize that much of what ACT is involved in is helping people to have thoughts and feelings without necessarily believing them, without them necessarily activating the HPA axis. So as I studied this, one of the things that I've been feeling is that really what we need to do is ensure that every person feels safe and cared for and has minimal stress. So, they need a hug if a hug is what will work for them. And so the image of hugging an HPA axis isn't too appealing. So here's my son and his son, which is to me at least a more appealing notion of what people need. But it's not just human beings. This is my cat Charlie, who's sitting over there. And on a sunny day, the sun shines through our skylights, and Charlie is well fed, he's safe, he's warm, he's comfortable. This is what every organism needs, is to feel safe and cared for. So I want to talk about coercion, because the number one stressor for people involves human relationships that involve coercion. What do I mean by coercion? I mean the use of aversive behavior to influence other people's behavior. And there's research that began actually here in Eugene that showed that parents and children who have relationships that involve coercion are significantly more likely to raise kids who have aggressive social behavior. So what do I mean by coercion? Well, let's say mom says, it's time to go to bed. And Johnny says, I don't want to go to bed. And mom backs off. Well, what just happened? Well, mom was reinforced because Johnny stopped screaming. Johnny was reinforced because he's not going to bed. What we found in research and family interactions is that families that have begun to use coercive behavior to deal with each other, aversive behavior to deal with each other, are significantly more likely to have problems as life goes on. And it's in fact also been found in marital relations that married couples who are having problems, the fundamental thing that's going on is that they've gotten good at using aversive behavior to stop the other person from doing things they don't like or to do things they want the other person to do, but they haven't gotten good with social graces and warmth and caring and patience and compassion and so on. And these are, of course, the very things that you're trying to help people develop. And we've also found that this is true in depression. My colleague Hy Hops and I did a study in which we looked at the interactions of married women and their husbands, and we found that women who are depressed actually, when they act depressed, it gets them some respite from the aversive behavior of other people in the family. No one was having fun with this, but it was a way in which the woman could cope with the aversive behavior of other people in the family. So I want to suggest that we think about traumatized children in particular and the exquisite sensitivity that they have. I want to argue that the genetic, epigenetic, neuroscience, and behavior analysis have converged to show that stressful and threatening environments result in all of these things. First of all, they result in impaired self-regulation. Kids who are in these kinds of aversive environments just don't develop the self-regulation they need to withhold their first impulse, to be patient, to plan ahead, to wait until their turn. Kids who are in more nurturing environments have thousands of experiences in which their self-regulation is developed when mom asks them to do something and they do it and mom responds positively. That can happen 50 to 100 times a day between a parent and a child, and that's how self-regulation is developed. Kids who are in threatening environments also become hypervigilant. They become more likely to feel that the other person can't be trusted, so they mistrust others. And that results in poor social relationships and rejected and marginalized, being rejected and marginalized. And that results in deviant peer group formation. What has been shown pretty clearly is that kids who are on this trajectory where they're rejected, where they're mistrustful, where they tend to be aggressive, become friends with other kids who are similarly rejected, and the result is an increase in the likelihood of early childbearing, early depression, obesity, and even cardiovascular disease. So here's a summary of what I'm saying. In the context of nurturing environments, kids develop good self-regulation. They develop language and social skills. They develop academic success and pro-social behavior, and they form good friendships. And what do you get? You get a compassionate, multiply skilled, resilient, and values-oriented person. But in the context of non-nurturing environments, kids develop poor self-regulation. They are more likely to become aggressive and uncooperative, and that leads to academic failure and peer rejection, and that leads to deviant peer group formation. And what do you get? Early childbearing, drug abuse, depression, and antisocial behavior. And the other thing to remember is that non-nurturing environments are associated with increased likelihood of cardiovascular disease. And this is why I would emphasize this, because the work that you're doing in reducing the degree to which people are engaged in coercive interactions is work that can contribute directly to reducing cardiovascular disease. And at least in this country, the healthcare establishment doesn't recognize how important these factors are for health. So I want to turn to a public health perspective. I would argue that to truly benefit human well-being, we need to go beyond the focus on affecting individuals, although that is foundational to what we need to do. We need to focus on the well-being of the entire population. The prevalence of well-being in the population is what I'm focused on. And I would argue that we can choose to make our goal that every person lives a long and productive life in caring relationships with others. Now, am I correct that most of you are clinical psychologists or doing therapy with individuals? Would you raise your hand if that's what you do? Okay. So it's important to you're sort of the front line of what we can do to help societies to be more nurturing and to reduce the kind of coercive interactions that occur. And I think that in addition to the work that we do with individuals, we need to think about the well-being of the population. And to the extent that you in your work and in the organizations that you're connected with can deal with the larger context that affects these populations, you can help to prevent some of the things that that lead people to end up on your doorstep. This is the report of the National Academy of Medicine on prevention that was published in 2009. And what we concluded, I was on the committee that wrote this report, was that we reviewed all of the research that had been done on the prevention of psychological and behavioral problems. And we concluded that the scientific foundation has been created for the nation to begin to create a society in which young people arrive at adulthood with the skills, interests, health habits, and values they need to lead a productive life in caring relationships with other people. And that's sort of the vision that prompted me to write The Nurture Effect and has really guided my work since then. This is a slide, a chart from the Institute of Medicine report. And on the top it shows developmental phases from prior to conception through young adulthood. And every one of these bracketed items refers to one or more interventions that have been shown to have benefit in preventing problems. And let me say a few things about these. Most of these interventions, and I'll just say what some of these are because it may be hard to read. There are prenatal care, there's home visiting during prenatal period and infancy. There are early childhood interventions. There are parenting skills training programs. There are social and behavioral skills training. There are classroom-based curricula that prevent substance abuse and aggressive behavior. There are programs to prevent depression. There's even evidence of our ability to prevent schizophrenia. And there are also prevention efforts that are focused on specific problems like bereavement. Somebody in the family dies, helping the family to cope with that, or to cope with divorce, or to cope with parental psychopathology. And there are also community interventions, and there are policy interventions. Policies that, those of us who tend to work more with individuals may not think about as much, but those policies can have important benefit. So there's a whole range of things here that are available. Most of these interventions have been validated in randomized trials and have shown long-term benefits. Most of them prevent multiple problems. And the reason they prevent multiple problems is because most of the problems stem from the same basic conditions: coercion and conflict in families and the failure to richly reinforce pro-social behavior. And so, and the other thing I should mention is that at least in the United States, studies of the return on investment for these programs show that the they produce a very positive return on investment. For every dollar you put into them, you save money in terms of reduced criminal justice costs, special education costs, healthcare costs, and so on. After I worked on the National Academy of Medicine, that report, I concluded that there are basically 4 things that are key things in these interventions. First of all, they help to minimize toxic social and biological conditions. Toxic social conditions are things like coercion and conflict I was talking about. But biological conditions are also to be avoided. High levels of airborne lead, high levels of omega-6 in the diet are both risk factors for problem development. The second thing that these interventions do is that they teach, promote, and richly reinforce diverse forms of pro-social behavior. The third is that they limit influences and opportunities for problem behavior. Influences like the marketing of cigarettes, alcohol, and unhealthful foods, and opportunities for problem behavior like kids home alone after school without an adult supervision. And the last thing they do is they promote psychological flexibility, which is a mindful approach to pursuing one's values. This slide is kind of old. It says there are more than 100 randomized trials. There are actually more than 200 randomized trials showing the value of helping people to develop their psychological flexibility for virtually every psychological and behavioral problem that I've identified. And if you're into the ACT research, you're well aware of that, I'm sure. So I just want to give you an overview of what's available to us. This is a slide that shows 8 family-based interventions, and there was a paper published by Leslie et al. In 2016 that summarized this. She identified 16 evidence-based programs, and so they're on 2 slides. And I just want to point out all of the problems that these interventions affect. Most of them affect the same kinds of things. They reduce delinquency, alcohol use, criminal behavior, depression, sexually risky behavior, and so on. So what I'm saying here is that we have a raft of effective interventions that are available to us, and we have the evidence to show that we can prevent most of the kinds of problems that most societies are struggling with. I'll just tell you about one of them. This is Parent Managing Training Oregon model. And you may think that I do this just because I'm from Oregon. But in fact, this was one of the first behavioral parenting skills training programs, and it's been used throughout the world. In fact, it's used less in Oregon than I would like, and it's something I'm working on. But it's a behavioral parenting skills program that grew out of Jerry Patterson's early work on teaching parents to use reinforcement, and out of his work on the observation of coercive processes, because he's the one who studied coercion in families first. And it helps parents, not therapists, to serve as the treatment agents for the children. The parents learn to track and record behavior, and they learn to replace coercion with positive reinforcement and consistent mild sanctions instead of more harsh and inconsistent discipline. And there are quite a number of randomized trials showing its value. And this is a slide just listing some of the many places in which this has been implemented. It's been widely implemented. Norway has implemented it throughout the country. So has Iceland. Michigan has as well. The Netherlands, actually, and they've replicated the effects of these. They're getting good results in all of these places. Then there's Positive Parenting Program, Triple P. This is a community-wide system of parent supports that has levels of intervention. It starts with brief media communication. It floods the community with positive information about how you can handle common problems. Then it has about 40 tip sheets that are specific advice for dealing with specific problems. For example, if you're having trouble getting your child to bed at night, there's a tip sheet for that. And what they found is that they can help people who reach parents, like preschool providers, to give this brief advice, and they can prevent the development of more serious problems. There have been multiple randomized trials showing its benefit, but there was one in particular in South Carolina where they randomized 18 counties, 9 of whom got the program and 9 of whom didn't. And they found that in the counties that got the triple P, there was a significant reduction in child maltreatment and a significant reduction in the need to put kids in foster care. So this is just one example of a sort of population-based approach, and this has been implemented. They have now reached about 7 million families around the world, so it's a good example of what's possible. Then there are evidence-based school interventions that affect social behavioral outcomes. Now, I'm just going to tell you about one of them, the good behavior game. The good behavior game involves helping kids to learn to cooperate. You put kids into groups of about 4, and you have them work on a task for a short period of time. And if they're on task and they're cooperating and they're not being disruptive, they can get a prize. So what's the prize? Well, it might be something like an extra 5 minutes of recess. And so, and every team can win. In other words, if this team's on task and this team is on task, they both win the prize. What they found is that this program helps kids to develop self-regulation and reduces disruptive behavior. And there was a randomized trial done in Baltimore, in inner city Baltimore, where they looked at the benefits of the program. And what they found was that in the first month there was more time for teaching and learning. There was less stress for staff and students. There was better attendance, fewer referrals, fewer service needs, less illness, happier families, less vandalism, and better academics. 2 to 3 years after the program, and the program was just done in 1st and 2nd grade, but by 3rd grade there was oppositional defiant disorder was prevented, and so was hyperactivity, and special education needs were reduced. They followed these kids into middle school, 6th, 7th grade. They were less likely to smoke, less likely to use alcohol. They had fewer conduct disorders. They followed these kids into adulthood and found that the kids who had gotten the good behavior just in 1st and 2nd grade were significantly more likely to graduate high school, attend college. They were less likely to have antisocial behavior, to use drugs, or to attempt suicide. That's a pretty strong and powerful outcome for a program that was just in 1st and 2nd grade. And a colleague of mine has added to this program a bunch of what we call kernels, which are simple behavior influence techniques, and things like Granny's Wacky Prizes. Granny's Wacky Prizes, the kids, when they succeed, there's a blue bag that says Granny's Wacky Prizes on it. And you pull out a prize, and it might be something like, make animal noises and find somebody making the same animal noise and join hands. It might take 30 seconds to a minute to do. The kids love it. In fact, all of the Granny's Wacky Prizes are things that you're not allowed to do in a classroom. But you get to do them in the classroom when you're on task. And so the kids love this stuff, and it reinforces pro-social behavior. I don't quite have time to do this. Let's see. I would argue that we've learned an enormous amount about how to make our family, schools, and workplaces and communities more nurturing, but we have much more to learn about how to influence the further evolution of society. So I want to talk about, first of all, the spread of evidence-based family interventions, because I think there are basically 2 things we can do. One is we can get these interventions more widely disseminated, and the other is we can begin to try and change the very foundation for our society in terms of the values we pursue. So I've talked about how PMTO is in multiple countries. The Nurse Family Partnership is another program that's reached 34,000 people. The Incredible Years, a family program in many countries, has reached 2 million families. Multisystemic Therapy, 200,000 families. The Positive Parenting Program, 7 million families. The point here is that these evidence-based programs are spreading, and with them we are spreading pro-social behavior and reducing the kind of aggressive, coercive, antisocial behavior that has so plagued societies for thousands of years. The same thing is true with the social-emotional interventions in schools. Positive behavior intervention and support is in 26,000 schools, mostly in the United States. Positive Action, another program, and these are all in my book if you want to pursue them, or you can send me an email if you want to pursue them. 5 million students have been reached with Positive Action, 2 million with PATHS program, and at least 20,000 teachers and 1 million children with the Good Behavior Game. The point is that we have these programs. They are making a difference. We are all part of an effort to improve human well-being that is growing and that is vital to the future of the world. There's a wonderful book by Wilkinson and Pickett called The Spirit Level, and it's the story of economic inequality. So economic inequality, here is countries vary in their inequality, and inequality is, how much do the richest people in the country make versus how much do the poorest people in the country make. And guess what? We're number one. The United States has the highest level of economic inequality of any country. And here's Italy. And down here are Japan, Norway, Finland, Sweden, Denmark. Okay? This is an index of social problems. If we took 5 minutes to list all of the problems that you think are important, it'd be on this list, including longevity. This is the relationship between economic inequality and these problems. And as you can see, the greater inequality, the more we have these problems. And by the way, economic inequality is not just due to having more poor people in a society. It's actually due to the stresses that occur in a society where there's greater inequality, because people who have less and people who have more rub up against each other, and very often those are stressful interactions, but for both the person with more money and the person with less money. And there's good evidence on this. So, and I know something about the recent politics of Italy, and I know something about the direction that much of public policy in Europe has been taking. And much of it is influenced by the promotion of free market economics that came out of the United States. And it ain't good. So there's a warning. You need to be concerned about that. And here's the story. How many are familiar with the invisible hand? The notion that if you simply pursue your own economic well-being, it will necessarily benefit everyone. That is the theory of free market economics, and it has taken over thinking in the United States over the last 40 or 50 years, and I know that it has increased its penetrance in other countries, because I know that, for example, Sweden has elected a government that is running under this theory, and I don't know exactly to what extent that's true in Italy, but I think that it's the free market thinking has had a deleterious effect, I know, in many parts of Europe. Massive advocacy for this point of view worldwide over the past 50 years. If you read my book, I have a description in there of the Powell memo, which instigated this advocacy, but I don't have time to go into it now. But I want to point out some of the excesses of capitalism from an evolutionary perspective. In the absence of regulation and countervailing political pressure, capitalist enterprises will maximize their profits any way they can. They'll minimize labor costs. They'll create monopolies if they can. They'll pollute. They'll deplete resources. They'll market harmful products. They'll get government contracts because it's just profitable. And they will lobby government. And in the United States, what we have a president who is the epitome of the self-aggrandizement of, I want to be rich, I want to be famous. But this is something that he's not an anomaly. This move in the United States toward this point of view has been growing over the last 50 years. And the book I'm now writing, which I hope to get out in the next year, called Evolving a More Nurturing Form of Capitalism, is an effort to move things in the opposite direction. I think we need a public health framework for reforming capitalism, and it has two prongs. First, we reduce the harm of specific practices. I have chapters on every one of these issues in my new book. They engage in practices that haven't been regulated and that harm people. The tobacco industry has killed about 20 million people in the United States in the last 50 years. We need, however, to balance the harms of companies against the benefits, and we can do that through regulation. I'm saying that the principle for regulating any corporation or any company should be what impact does it have on harmful impact does it have, but you have to balance that against the benefits. And that, to me, is a public health standard for regulating capitalism. The second thing, though, we have to do is make the goal of ensuring everyone's well-being the foundational value for public policy making. This is the choice. It's a choice between whether you want a society that says we want people to be able to just pursue their own wealth no matter what, or we want a society in which we want to make our foundational value that everyone has a fair opportunity to live a caring and productive life. And I think we begin by articulating and promoting our values. Every person lives a productive life in caring relationships with others. And I submit that behavioral science has already established the kinds of environments we need to further this value, and a wealth of programs and policies. And I haven't talked much about poverty. You don't have nearly as much poverty as we do in this country, but poorer people are strained in ways that harm their families. And I think we need to reform every sector of society. The business sector, of course, but also the healthcare, involving it into a public health approach. We need to reform the criminal justice system, the education system, and our system of religious and secular values, and the media. And you're going to have to judge how much this is relevant to Italy, but what I have seen in other countries in Europe is that there has been a slow movement toward a model like the United States, and you believe me, you don't want to go there. So in every sector, I think we have to persistently ask whether the practices of that sector nurture well-being or undermine it. And ultimately, we need a grand coalition that links people in every sector of society, people and organizations that are making the well-being of every person their foundational goal. And I think behavioral science is fundamental to this for all of the reasons that I've given you. And I just want to do one more thing. This is a word cloud that came out of the good behavior game efforts in a number of elementary schools. We just asked kids, what do you want to see, hear, feel, and do more of? And these are the things they said, and the bigger words were the words that more kids said. But I haven't just done this with schools. This is one that I did in a community in Oregon where I said, what do you want the community to be about? And I'm doing this everywhere I go. So if you have, how many people, could you raise your hand if you have an iPhone? Oh, Steve Jobs needs to, yeah, okay. So if you have if you take your camera out on your iPhone and you go to this and you take, if you put your camera on your iPhone on this QR code, it will take you to a website where you can put in words that describe what you want Italy to be about. What are the values that you want to promote in Italy? And if you don't have a QR reader on your cell phone, it doesn't have to be an iPhone to be able to read it. But if you have any kind of cell phone, if you simply go to www.menti.com and use the code that I put on here, you can go there and you can put in the words that you want. So this is an opportunity for everybody there to contribute to your vision of what you want Italy to be about.
Tony, sorry, do you hear me? Do you want it in Italian or in English?
Oh, good point.
Just because the visual output to be coherent. Or...
Well, it'll work better for me if it's in English.
Okay, we'll try.
and of course I can give you the words and you can then translate them into
Italian.
I mean
it's 3 words. I can.
Yes.
I guess people can do it by themselves. Okay.
Yeah, they can do
Quindi
it either
fatelo in italiano in inglese, ok?
Yeah.
Stavo dicendo il contrario.
And what I'm trying to do is create a movement of people around the world who are trying to make their societies more nurturing. And I'm just getting started with this. I hope that my book, Evolving a More Nurturing Form of Capitalism, will come out in the next 8 months or so. But I also have created a website. And the website is, if people have got this, I'll go to the next slide. If you go to Values to Action, and I have a guide to progressive change. and it's just a short PDF. But if you get that PDF, and we'll capture your email address, we'll get back to you as we develop Values to Action, because Values to Action is an effort to help organize a movement worldwide to help move each of the sectors of society toward engaging in the practices that we need to ensure that every person's well-being is promoted. And so I think that's a place to stop, and I'm quite curious whether this talk from 8,000 miles away was of any value to you. And I would appreciate, you can email me at Tony, Tony at ori.org, and I'd love your feedback, good, bad, or indifferent. This is a learning experience for me. And I guess the other thing I would say is, I come back to what I said at the beginning, that you are the front lines of an effort to make societies more caring, more compassionate, more effective in nurturing everybody. And to the extent that we can work together on that project, we will be more effective as a whole. So I think on that note, if there are any questions or conversation I'd love to have, or maybe we've run out of time. I can see you applauding. I can't hear you, but hey, thank you.
Thank you, Tony, for your rich talk. I hope you impact strong on the audience. I'm sure that you impacted strong in the audience. And a special thanks for mentioning the Zebra Salposky's book, because it's for me it's a dig in the 90s. We translated the book, and many of my students learned on that book. It's a great book, really. Unfortunately, it was not a successful book in Italy, but all the students who read that book, I think, brought something important in their repertoire. Io penso che abbia dato una visione di una ricchezza, di una capacità, di un'ampiezza per quello che non solo la clinica, ma tutta la scienza del comportamento può dare. Just this morning, coming here, I heard broadcast radio, and they gave some data about the consuming of antidepressant drugs in Europe and in Italy. And Italy is the fourth country in Europe for abusing of antidepressant. It's very impressive data. And the cost of that is crazy.
I have a chapter in my new book on the pharmaceutical industry and the degree to which they have marketed medications that are in fact are less helpful and sometimes quite harmful. And one of them is antidepressant medication.
Domande, commenti? Giornata lunga, ma un rush finale, uno spunto, uno sprint. Giovanni, Serenella, io vedo che loro hanno lì in punta.
Io volevo dire che, a parte che ho capito tutte le parole che ha detto, quindi parla meglio lui in inglese per un italiano di quanto io possa parlare italiano direttamente a un italiano. E E poi sì, mi ha impressionato il fatto che mi ha commosso più lui dei miei esercizi esperienziali, per dire.
I understand what you say. He felt very smart because he understood every single word. And that's very good for non-native English speaker. But what he say is that the last sentence is that he not only understood the language, but your words were moving for Giovanni more than some compassion exercise. And I know what he said because I heard you many times. So I completely agree with Giovanni.
Well, I feel quite humble about this. Who the hell am I to think that I can change the world? But I'm 74 years old, and I hate golf, so I haven't retired. But I think we can do this, and I think we must do this, because the world is in serious trouble. And you guys are the people who understand that, and understand human behavior, understand what can be done about it. And so I hope you'll join Values to Action, and it may take a while for us to get that all organized, but just go and get this PDF, not to get the PDF, but so I can capture your email address, and we will get back to you about efforts to try to organize a worldwide movement to push for the kind of societies that we want. And if you fill out that word cloud, we'll get that back to you. We'll do it in Italian, we'll do it in English, but we've taken those word clouds, and in high schools we have kids create those word clouds, and we put them on one side of a piece of paper, and on the other is a praise note. And so they write a praise note to someone to try to promote those kinds of values. So we can do this, and I thank you for the opportunity to talk and for your patience in letting me do it from my study rather than come there.
I'm very close. I feel very close to you. I'm 68, so I'm very close to retirement. But even if we live in a very bad time, we are living in the time of the death of expertise. The intellectual elites are the devil, are shit. They, all these people, must keep on pushing, because we are really in trouble, I think, in a very general sense. And what we can do is speaking loud, because we don't risk anything. We are at the end of our career. We can say everything now. My friend Roberto, where is Roberto? Roberto Anchisi. We often say that. We can speak loud and say everything about what we should do, but you should do. We can do just the little things, but you have to do.
Well, you know, the ACT perspective tells us that you can have meaning in your life even when you aren't succeeding, and that really what it's about is living your values even in the context of difficult things, and that's what makes life meaningful. And that and my cat Charlie on my lap as I work, it's working for me. So
any other questions? Thank you, Tony, from the deep of my heart. Hope to see you soon. Thank you again.
okay, I wish you well. Bye-bye.